Hi, I'm Dr. Brad Shook, board certified chiropractic physician at Hickory Spine in Hickory, North Carolina. And today I want to talk to you about epidural injections for spinal pain and will they help? And the important thing to understand is that there is a process that you should go through if you're having back pain. First, you should try all non-surgical alternatives first. So things like chiropractic care, advanced chiropractic care, then if that fails, moving into something like considering seeing a specialist and getting oral medications, pain medications. If that doesn't work, then progressing to the next stage of more invasive approaches like epidural steroids. And then if the epidurals fail, then surgical intervention would be something that would need to be considered. So there is a process, and you don't want to skip one of those steps before you go to the next step without really good reason, because one of the things that the more invasive that you go, using injections, using medications and surgeries, first of all, you cannot ever change things back the way they were, and those other more invasive procedures have greater risk factors. Okay, they're a greater risk and potential for problems as a result of the treatment. So one of the things that really comes up a lot are epidurals, and are they helpful? And epidurals can be beneficial. It's an injection into the spine at the area where the doctor thinks that the inflammation is originating, to try and decrease pain locally and break a pain cycle. They can be a very useful tool, but you've got to understand it's a steroid that they're injecting, and these steroids are anti-inflammatory. They're not the muscle building steroids. They're actually anti-inflammatory steroids that, when used with repetition, they actually take the minerals out of the bones. They demineralize the bone. They weaken the muscles. They weaken the ligaments that hold the spine together. So they're not something you would want to use for a long period of time, and they definitely want to be something that you use after you have exhausted your other options, because they are invasive and there are potential side effects and risks. But they are part of a process of care that are I think that is essential and that is helpful. Thank goodness we have those more invasive procedures should our conservative approaches fail. We want to do everything naturally we can, but if we don't have that option, we've got these other tools that are available and that can be beneficial. So epidurals, it's not a first step to take, but it is something that could be considered in your continuum of care should need be, right? So anyway, I hope this helps you to better understand epidural injections and really would they work if they would work for nerve pain like sciatica. They can be beneficial, but you want to do them at the right and the appropriate time. So anyway, I'm Dr. Shook. If you'd like for me to take a look at your sciatica, see if I could help you, give you my opinion, I'd be happy to do so. Just give us a call. Our phone number is 828-324-0800. You can also go to hickoryspine.com and learn more about what we do here in our office. But I hope this has helped you, and I hope you have a wonderful day. Thanks.